Welcome to the show, Brain Health, Unchaining Your Pain. And I am joined by the wonderful Dr. Katyna Rosario, who is a clinical psychiatrist at the Amen Clinics in the new office of Miami, Florida. Welcome to the show, Katyna.
Hola.
Hola, ¿cómo estás?
Yeah, you too. Thank you for having me.
Oh, you are most welcome. It's just such a pleasure to talk to one of the amazing psychiatrists that I liaise with, as you know, with the Amen Clinics and in partnership with the Amen Clinics. And it's just fantastic to talk to yourself and the new clinic in Miami. So I'm really excited to see where this conversation goes today in the context of brain health, because it's such a important topic in today's world, given the recent instance in the States, the pandemic, and the uncertainty that we have in terms of the war that's going on in Europe as well.
Mm-hmm. Yeah.
So I would love to know, before we dive into your story, what is it that you are passionate about in life right now?
Yeah, for me, like I'm a child psychiatrist. So for me, my passion is keeping that magic in childhood, like keeping that childhood alive. So that's what makes me happy of what I do.
Yeah.
I see adults too, but like we can keep the childhood alive in adults too.
Do you know, I think it's so important. It was something that my dad was really keen on doing, which is why I wrote his stories, about Peter Pixie and Paula Pixie, is bringing that magic to children. And it's so easy to have it pushed out of them at a young age through whatever circumstances may befall them. And I think it's something that is just fundamental to ignite children's imagination in a really positive and supportive way, and allow children to be children for as long as possible, because our childhood is so short, isn't it?
Exactly. And I feel like I had the best childhood ever. So I had a strong base. Like even when everything else like might go wrong, like I still have that base that helped me to keep on.
Yeah, and I think having that really strong foundation as a child is really fundamental to being successful in life, and it's not something that every child unfortunately gets. And I know we're going to dive into that, but I'd love for you to describe, before we do that, the picture behind you, because I know we were talking about this before the show, and for those that aren't obviously not watching but listening, could you describe it, please?
So like that's a giraffe. I love giraffes, but they are like the symbol of psychoanalysis in children. So I feel like it's not only the giraffe, it's that it's really playful and it has like the eyelashes. It's like it describes me.
Yeah, and you know, I love the fact it's got pink glasses on and he's blowing
Yeah.
a bubble out of his mouth that's also pink, which I can imagine if you're talking to children over Zoom or whatever, it must be quite entertaining for them to go, "What's that in the background?"
I know you have to keep it alive, like however you can. Yes, and that's what I miss the most about seeing them in person, like being able to
Yeah.
like really like engage a little bit more. Okay.
Yeah, and you know, I think that's such an important point for kids, because I know when just before lockdown, in fact, it was actually during lockdown, my daughter Lily, she was suspected of having a heart murmur, and she was taken to see a paediatrician called Dr. Kelly, and we went and saw him physically. And she couldn't stop talking about Dr. Kelly because he became her like a superhero. And it was really easy to have a conversation with her, even though she's only 18 months old, because we talked about a heart, which is an organ. It was never talked about her as a person being 40, but making sure her heart was okay. And then imaging a heart and checking that everything was working, looking at the heart's function. And she left there just talking about Dr. Kelly until the cows came home, or the giraffes in your case. And I think that's something that's so fundamental, isn't it, in terms of bringing brain health to life in children, is because it's super easy to talk to a child about their brain, because you can point to where it is and you can explain it. Whereas it's really difficult. I can't have a conversation with my daughter about mental health because it's just an ethereal thing that they can't grasp
Mhm. But
contextually.
now that you mentioned that, they really listen. Like I always show I have a 13-year-old,
Uh-huh.
so I always show him the scans and everything I'm doing. So like one time he went to his classroom and he was saying like, well, if you do pot and you do this, you're gonna have your brain full of holes. And people were looking at him like, what are you talking about? And then he started explaining what I did. And they really listen. So like having this kind of like concrete imaging helps a lot too. Mhm.
Absolutely. And I think it's such an important piece because it's easy to point a finger, isn't it, when we talk, and I really love to get into this conversation in the context of children, because obviously we know that children's mental health is on the rise
Mhm.
significantly. There's been a
Mhm.
huge shift since the pandemic, and I think it's just the start of a wave of chronic mental health struggles,
Mhm.
globally, never mind in the US and in the UK.
Mhm.
And the thing that I always find is difficult is when just the language we use when we talk about mental health is we talk about ourselves in the context of I have a mental health problem. Whereas when we talk about our brain health,
Mhm.
it's a
Mhm.
third person, or it's a third object. So you're never talking about you're talking about the organ in the same way as I said, mentioned about the heart. So it's not about you being faulty, it's about your brain being in trouble in the same way as a car engine
Mhm.
can be in trouble. It doesn't mean the car's broken. It just
Exactly.
means the engine needs servicing.
Mhm.
And bringing it to life for children in a way that isn't shaming and blaming, but
Yeah.
getting them to really truly understand that their brain needs support.
Yeah, and it really removes a lot of the guilt that they feel whenever they misbehave. Like it gives them like that hope to really want to work to improve their brain health. So I feel it's really, really important. Mhm.
Yeah, I think so. And I'd love to know, in the context of your journey, what is optimal brain health for you personally? How would you describe it?
More like having a balance. It's
Hmm.
it's and it's the same way that I explain the scans, that I explain the activity. Like if we get a balance, like
Hmm.
we're gonna have like a healthy brain. So
Hmm.
like including nutrition, activity, like social engagement, that connectivity, keeping that social connection, all that is really important.
Mm. And I love the fact that you use that word balance,
Mm-hmm.
because we often talk about being either the right side or the wrong side of normal,
Mm-hmm.
but there is no normal in the context of brain health, really,
Mm-hmm.
because we all have a unique brain, and it's about bringing it into balance for you personally, and it could be different for everybody, and
Yeah,
making sure that that balance is optimal for that particular individual.
exactly. I get that question asked like a lot of the times. Is like, if my like is my brain like so bad? I'm like, I'm gonna compare your brain to yourself, like more like we're gonna see your journey. So this is
Hmm.
our startup point, and then we are gonna go from here. But that is something that always comes up. Like, how
Mm,
do I compare
mm,
myself with others? And mhm.
mm. And I think it's so easy, isn't it? Because if we think of normal in the context of people's size, if we take the United States as the status, 75%, I think, is the current statistics of people in the States are obese. And
Mhm.
that's normal,
Mhm.
but that's not optimal.
Exactly. Mhm.
And so it's about finding what's optimal and finding that balance for you so that your brain is working at the best it can be. So
Yeah.
I'd love to explore your story, because let me just introduce you, because I haven't introduced you yet. So for those that don't know Katyna, she's a an adolescent psychiatrist, and also an adult psychiatrist based at the Amen Clinics in the new clinic in Miami in Florida. She sees children, teens and adults and treats a wide range of mental health diagnoses. She's completely bilingual in Spanish and English, and she works with patients who speak either language. And she's published many research articles, including adolescent mental health in Latino communities and the impact of internet addiction, which I'd love to explore on this show, and the use of psychiatric services in this population, as well as the beneficial influence clowning has on mental health in children. And of note to that you are a professional clown.
Yes, I am.
Which I totally love. I think
Yeah,
that's amazing.
I started in high school and then I took classes. So I had a graduation and everything about like yes.
Did
Yes.
you? What
Mm-hmm.
inspired you to do that? I'm so curious. I think it's a fantastic thing. My dad was massively into amateur dramatics.
Mm-hmm.
And you know, if he had a clown, he didn't need to wear clown suits.
Yeah. So yes, my son also like he doesn't need to wear a clown suit to be a clown, but like he might inherited that from me. But I'm always like I really like to incorporate like anything that is artistic. Um and since high school I was always like the clown in activities, and then like even in med school I was always the clown, and like I was never the med student. I was, oh no, like we're gonna do an activity, it's a community service. Oh yes, I am the clown, I know.
And I think it's such an important thing for people to do, because
Mhm.
it can bring so much joy into
Yeah,
people's lives in ways that they maybe never expected it. And often that's the poignant memories that you can have in your life is
I know, no.
meeting clowns that are not scary but really funny.
You know what, I have like some really funny stories. I used to work at a department store as a clown. I just do the balloons there, and I wasn't a psychiatrist back then, but people came to me and they told me their stories and they confide on me. I was like, okay. So even like being like that, they were able to really like engage and trust me. So yes.
Yeah.
Hmm.
And I think that's really key, isn't it? Because, you know, it's about creating that safe space for people just to express themselves.
Hmm.
And I think when you're a clown, you just totally, there's no kind of reservations.
Exactly. Yes, you get to be you. Hmm.
Exactly. And
Hmm.
you can be you in whatever way you choose to be, and you can be not you as
Hmm.
well. Just be completely different,
Hmm.
to how you would normally, you know, show up in your community or in your workplace, and it's just encompassing all of that, isn't it?
Yes. Yes. Hmm.
So I'd love to know your story that inspired you to become a psychiatrist. If you could take me on your journey, if that's okay.
Well, I've always wanted to be a more like a pediatrician, like more like something related to children, like since I can remember. So once I started doing my rotations, I fell in love with psychiatry,
Mm,
and I was like, well, this is what I want to do the rest of my life. So
mm.
it was. I feel like I was like 4, like when I
Wow.
really recall, like going to my pediatrician's office and him like, and that really makes a difference, like him being able to explain to me, oh, like I'm gonna listen to your heart and all those things, and like
Yeah.
it stays with you. And I told him like I want to be just like you. So
Yeah.
those role models are really important.
Yeah. My mum was actually a nurse, and she wanted to become a nurse based on her hospital experience. I think it was caring for a grandmother, and
Hmm.
she was helped in the ward by a nurse, and that
Hmm.
nurse became a role model, and so she became a nurse herself. And I know for me personally, although I'm not a medical doctor because I didn't think I had the intelligence to become one, um,
Hmm.
I was really inspired throughout my um, growing up by the medical profession, I always wanted to be connected to it in some way, to support people and getting the best out of themselves. And it's finding that really important role model, isn't it?
Yeah.
And often that can come so early on in life. I think the earliest memory I have of the hospital was when I broke my arm jumping off a settee when I was about 2 years old, thinking I was Batman, and ended up walking. I can remember to this day, very clearly walking down a big long corridor with my arm in a sling or something like that. But I certainly remember the corridor and going to the doctor's office to get assessed. So it's really poignant. So I'd love to know, obviously you chose to do psychiatry and childhood psychiatry. What is it that you notice most in your practice in terms of supporting children or adolescents?
Well, the part of the trauma, like having that emotional trauma, like has been there all the time. And now that I'm working at Amen clinics, like I'm able to really understand what's going on in terms of the activity. So I'm new at the Amen clinics. I've been here for a year. So I still consider myself new here. But it's been really, really amazing just because I've been able to have like a different view of what I used to treat, and now like I'm really treating like in a different way.
I'd love to know how that shifted, because I know it's, the Amen clinic methodology is quite different to what traditional psychiatry tends to do. And I know Dr. Amen talks about, often it's the traditional route is you make your analysis based on symptoms and symptom clusters, and you treat the symptom and not necessarily understand what lies behind the root cause. But obviously brain imaging using SPECT can give you a much broader and more insightful picture, because you're actually looking at the brain, not just guessing what's wrong with it, and understand how the brain's functioning. What's been the huge shift for you?
I feel that even with just one visit, I'm really able to help my patient.
Wow.
It's so amazing. Like I call it like this is my Disney World in psychiatry, just because it's so exciting that again, I'm able to give them the recommendations that they really need. It's not I'm gonna try this and let's see if it works. It's so different. Like it's a completely different approach from what I used to do before. And the same in the time that we spend with the patients. Like I do my evaluation and I spend 2 hours with them, like versus what I used to do in the real outpatient practice that like you just have 30 minutes or so with the patients. So it's a different approach. And so I feel like the main difference is that I'm able to help them in just one visit.
Wow, that's amazing. Because if you consider how long it can sometimes take people on their journey of recovery and brain health optimization, whatever that looks like for them, cutting down the number of interventions. And I think it's about 4 or 5 medical interventions that have not worked, or 4 or 5 different visits that people have undertaken before they actually get to the Amen clinics to get themselves treated appropriately. It is just, especially for kids, because it can be so traumatic, can't it?
And like my children, like the kids are the best patients ever. Like they're even like easier to work with than adults, just because like if you really engage them in the treatment, they're gonna follow those instructions to the T. So like that's really, really positive.
Yeah, and I think they also don't come with hopefully so many hang-ups, obviously depending on the childhood experience that they have, that tells them that they can't. Children tend to go into medical help in the fact that I can get better because they don't have these hang-ups that to say that they
prior
can't.
experiences. Exactly. Yes. So I see results in 1 month, 2 months, and in patients that, like, again, like that had a lot of trauma, adopted patients, that, like, we really don't know what happened prior to the adoption, and
Sure.
that change that we see in them, it's amazing.
And do you know, I think I'd love to discuss the impact of childhood trauma, because it's often something that I see in my clients, and I know I do get referrals through the clinic, is to help them really unchain their pain, using the techniques that I use, which is havening, combined with some of the techniques that's applied through the Amen clinics. But often I think for children that have trauma, they can't verbalize it.
Exactly.
Because they don't have the voice at the age the trauma occurred to tell you about it. And so it gets encoded differently. And what I've noticed, and I'd love to get your view on this, is sometimes CBT, or cognitive behavioral therapy, doesn't quite do it for everybody, especially if it's a childhood trauma, because they can't cognitively unchain their pain because they don't have the words to be able to express themselves and articulate what's truly happened, especially if it's really young, and right down to birth trauma as well.
Yeah, and for example, when we see the scans, we have some, like, emotional trauma patterns. That helps me to ask better questions. Sometimes, like, that kind of history, it's not even there. And when I start asking, is that they start, like, really exploring all the things that have happened that might be related to that kind of emotional trauma pattern. Okay.
Yeah.
So I feel like that's really important.
And do you feel that so what I sometimes find is people downplay the impact that something has had in their childhood, that something's happened in their child, that they downplay it and don't think it's important, because they compare themselves to others, and so they say, well, my trauma isn't as bad as
Yeah.
but it's still trauma.
Even if it was bullying, like, sometimes they just take it like, well, like, I did have bullying, but when you go to the scans, you see that that kind of bullying had a lot of impact.
Yeah. And I think that's a really important point. You know, so many people who've been guests on my show, and Rex Miller, who is a client, he took his children to see the Amen clinics to untangle the problems, the struggles that they had. Is there was a lot of bullying trauma that was encoded in their mind, and actually was being misdiagnosed, or just missed, never mind diagnosed, because nobody actually looked at their brains
Exactly.
to understand. And could you explain to people who are not unfamiliar with SPECT what it is, which single photon emission computed tomography, but what it is that you typically see in children who have experienced a traumatic event? What types of changes you notice in the brain that show up on a SPECT scan?
So what we usually see in the specs is, like, we deal with function, so it's mostly activity and blood flow. So the things that we see in terms of the scans, for example, maybe we can see, like, a ring of fire, just because, like, that brain, it's so, like, active in terms of the emotional brain. But we also have what we call a diamond pattern. And that's when we have certain areas that are lit up at once. And that's the one that is mostly related to emotional trauma. So we see activity in the cingulate, and that's mostly related to kids that get stuck on things, that are inflexible, that really worry a lot. And we see activity in the basal ganglia, and that's when they are like really anxious. Okay. And we also have activity in the limbic system that's related mostly to depression, poor motivation. So symptoms like that. And when we have activity in all those areas that are lit up at once, that's what we call the diamond pattern. And that's related to emotional trauma.
Yeah. And I think it's such a powerful tool, isn't it? Because people with PTSD often have a diamond pattern or post-traumatic stress disorder, because all of their the trauma that they experience at the time, which starts off being encoded through the amygdala, lights up or activates all of those other regions, depending on the breadth of trauma that they experience, whether that's in a singular event, which it could be, or in a series of events
that
that
accumulates
then
over
stack.
time. Yeah, but sometimes they don't even have the symptoms of PTSD, like all the symptoms, and that's when we make a difference, just because he doesn't have the symptoms of to meet the criteria for PTSD. But when we see the scans, like, we meet the criteria for emotional trauma, so we need to treat that.
And I think that's really key, isn't it? Because the fact that diagnosis on symptoms doesn't necessarily address the root cause of the problem is so key, especially when it's for everybody, but when children are evolving, their brains don't fully mature, do they, until they're 25 as females or 28 as males. So there's the chance to rewire their brains, because they're much more malleable than they are when we grow up as adults.
Exactly. And if you teach them how to improve that activity, like, they are really going to do it. So, for example, I tell them, well, there's an area in your brain that it's a little bit decreasing activity. And like, when I talk about the cerebellum, and I told them, if you play ping pong, that area is going to lit up. And they say, really? So just trying to engage in that way, like, they're going to be empowered in terms of the treatment.
And I love that, because often we compete against others, but the power of brain imaging is you end up competing with yourself.
Exactly.
So it's once people see the brain, especially as children, and you show them what balanced looks like, or what if they do these 10 things or 5 things, whatever it happens to be, how their brain can improve, then they've got that, and they're motivated, then they've got that opportunity to compete against themselves and get the best out of themselves, which is wonderful.
Yeah. And like, you should see their faces when they see their scans. Like, they really get like excited about the treatment, because they are able to see.
Because that picture paints 1,000 words, especially when for children. So important. And if I think back to my daughter, she's only 3, we're always talking about her brain, what's good for a brain and bad for a brain, and how she can manage her, focusing on managing her emotions, but in the context of helping bring her brain back under control. And how could she do that? Because obviously kids who are young, their emotions are very fiery, depending on their age as they develop, and helping them learn how to manage it is so important. What do you think is missing in the context of education? Because I like to use a framework called REACH, which is reframing the conversation from mental health to brain health, because it takes away the shame and the stigma, and you talk about the organ rather than the person. And the second one, E, is education. What do you think is missing for children at the moment that maybe we could do more of as a society or as a nation to help children and adolescents take charge of their brain health in a more constructive way?
Yeah, I feel like in terms of like of course, nutrition plays a role. Like
Yeah.
it's a really important role, but the part of like all those contact sports and brain trauma, like
Mm.
we as a society, we promote those sports. Okay, and for us it's like, oh, like he's the best in football, he's the best here. And sometimes it's really hard. Like I'm gonna give you my personal example. My son, he wanted to do boxing.
Mm-hmm.
I'm like, and I've seen all the scans of the boxers, and I told him, well, like you can practice, but you're not gonna compete. Okay. And this
Mm-hmm.
is what we can get if we have like this exposure to continuous trauma. Okay. Even if you don't have a concussion, even if you don't like have any structural changes. Okay. So I feel like again, sports are really important in terms of like keeping that activity, but we have to like show them what can happen with certain sports. I feel like we don't do that.
No, I
Mhm.
totally agree. And there's a big court case here in the UK
Mhm.
for rugby players, actually, in the rugby union,
Mhm.
who, and I know the research was done by the Amen clinics in the States with the NFL study
Yeah.
on the impact of head trauma or
Mhm.
non-concussive blows
Mhm. Mhm.
can have on brain health. And I like to call it, so we often talk about head trauma, which I just mentioned, but I like to think of it as brain trauma
Mhm.
because it is your brain that's traumatized. Like you would if you punch your arm,
Mhm.
you get a bruise. And it's
Mhm.
exactly the same when your brain rattles around inside your head. And I know that rugby players were not aware of the risks, in particular, early cognitive decline, Alzheimer's, and so on, that
Exactly.
the professional sport would result from them playing professional rugby, or indeed any rugby,
Mhm.
at
Mhm. Mhm.
whatever age. And I think here in the UK, we, for reasons that I don't think parents truly appreciate, they're promoting
Exactly. Mhm.
contact sports that will damage our children's future. And football is another classic, or soccer from a stateside perspective, is even more risky for women, because our brains are more susceptible to damage. And
Mhm.
it might be because we have more neural networks
Mhm.
and less neurons than men. I don't know the true answer behind that, but we're disadvantaging our children by giving them contact sports that's really going to do them harm. And I am a victim of this myself,
I know. I
because I
know.
went to the Amen clinics to get my brain scan because I noticed cognitive decline and I struggle with my words sometimes. And that was a consequence of multiple layers of non-concussive blows to my head, from skiing, falling off bikes, probably playing football when I was a kid,
Mhm.
or soccer.
Mhm. Mhm.
Um, and it all stacks. It doesn't.
It
It's not just a
yes.
one and done.
Mhm. Mhm. Mhm.
It
Yeah.
layers, doesn't it?
Yeah, and it again, like you said, it accumulates and it becomes worse and worse. And if we do and we start doing something, for example, I tell them, well, we can start doing this to improve the activity here, but if we keep doing those things that we already like we're doing, then like it's gonna counteract what we're trying to fix.
Mm.
But yes, I feel like I'm more aware of like brain like trauma in terms of like contact sports now that I was before. Okay.
Yeah.
So yeah.
Yeah, I agree. And I had absolutely no idea until I went to the Amen clinics
Mm-hmm.
myself, how damaging contact sports is,
Yeah.
for people in the
Mm-hmm.
context of their brain health and their brain development, and the long term impact. There's no cure for Alzheimer's,
Mm-hmm.
but it's a huge risk factor.
Exactly. So prevention. Mm-hmm.
Prevention.
Mm-hmm.
Um, and I'd love to dive into one of your specialties that we mentioned, which is autism. And I know you talked about the ring of fire. Could you explain what the ring of fire actually means in the context of brain health? Because I believe that shows up in autistic children. Is that correct?
Yeah, I can show that, and they can also have decreased activity in the cerebellum. That it's like related to that coordination. I'm from Puerto Rico, so I'm an island girl, and we have there are like some kind of like treatment with surfing, so it's more like a surf based therapy, and that the first time I was talking to Dr. Amen, I didn't relate that just because I was starting and he was just interviewing me. And he said, well, that's really interesting that you talk about the coordination and about the vestibular system and all that we do with the surf therapy. And we have seen in patients with autism that there is decreased activity in the cerebellum. Okay. So that's when we promote like ping pong, tennis, like martial arts. Like, again, all racket sports are the best sports for the brain. Okay. So again, having that connection, like it really clicked, because whenever we do the surf therapy with those children, the improvement in terms, not only in terms of their coordination, also in terms of their social engagement, they improve a lot in terms of language. So we've seen a lot of improvement with activities like that. And when I translate that to what we do in the Amen clinics, it correlates with what I see in the scans, that there's like that decreased activity in the cerebellum. The cerebellum can also be affected by ADHD and alcohol abuse. Okay. But like we've seen that in autism, it's decreased. The same with what you mentioned in terms of like ring of fire. Like that's when the emotional brain, the active scan, it's lit up like a Christmas tree. So and that's why they're not able to really contain those emotions.
Because every area of their brain is active, so it's not
Yes.
just the ring of fire, it's their temporal lobes where they've got anger, where they manage their anger, and then that's mood control as well, isn't it? So the whole of their region of their brain is lit up.
And we also have the cingulate, that it's connected to those
Yeah.
obsessive thoughts and compulsive behavior that we can also see in autism.
So and do you know, I love the fact that surfing is such a powerful tool, because I mean, we can't not all of us can do surfing. So I know obviously ping pong and tennis is super helpful for children who are on the autism spectrum, but also climbing is a really good one. So indoor climbing or dance.
Yes, dancing. Again, dancing, it's really, really good. Martial arts. If you don't want to do something that it's so active, like promote drawing, calligraphy. Yes.
It's
But
something that requires coordination, basically, a lot
yes.
of hand-eye coordination, a lot of fine motor skills is really, really helpful. And I know when we had our wedding, we have people in the family who are autistic, on the autism spectrum, and we had a climbing wall as part of our wedding.
Really? That is so awesome.
And the kids loved it, because they could go up and, I mean, it was pouring with rain, as it tends to be in the UK, but they just went up and down it, and people that, you know, were on the spectrum just really loved it and really got a huge amount of benefit from it. And I didn't realize this at the time, but you know, it can be hugely beneficial for children who have low activity in the cerebellum or on the autism.
Yeah. So yes,
spectrum.
Since we're in Florida, I also recommend that for them too. But in Puerto Rico, like the initiative is called Surf for Them. Okay.
Wow.
So I really love it. I miss that too.
I am so rubbish at surfing. It's not something that I ever quite got the hang of. I don't think I ever really stood up on a board and managed to surf without going and crashing in the waves. So I imagine it, you know, it's such a a physical sport, isn't it? And requires so much coordination to do it properly. I just think that's brilliant. I'd love to transition now into your fun facts, which is all about the 5 pillars of brain health, which I talk about with my clients. And that's remembered by the mnemonic facts, where F is for feelings, A is for actions, C is for connections, T is for thoughts and those ants that we have in our head, automatic negative thoughts, and S is for surroundings. So I'm going to just dive in and ask you some fun facts if you're ready. So just diving to feelings, what is the funniest or most embarrassing thing that's ever happened to you?
Oh wow. like there are so many things. Like I'm always in the floor. Like there was one time, like I was crossing the street and I was already in med school. And I usually like to have like a lot of books. And I was with my robe. Like I was like, of course, I was one of the first years of med school. And I don't know, like I tripped and all the books went flying and I fell in the middle of the street. So yeah, everybody saw me. Yeah, but I think like I have so many fun things that happen, like that funny things. Yeah, but I'm always on the floor. Yeah.
Well, at least hopefully you'll be able to get up and dust yourself off and dust your pride off as well at the same time.
Yeah, no, again, like and again, like I'm trying to increase the activity in my cerebellum just because like my coordination, it's awful. Yeah.
Well, you'll have to play ping pong with Dr. Amen, and
Yeah.
although apparently is quite an expert. So.
And then he likes to knit too.
Does he? Ah,
And
that's another brilliant thing to do, actually.
that
Or
also
crochet.
helps. Yes, knitting. It promotes a lot of that activity too.
Yeah, I think that's brilliant. I haven't done that for years. It's something that I really need to probably get back to. So I can show my daughter at least how to knit. So let's go on to the next one. On actions. What's the most rewarding or fulfilling thing you've ever done?
I really like to work with the community. So for me, all the activities that I do with the community are the most rewarding. So here, it has been a little bit harder with COVID, and when I moved here, it was after Hurricane Maria in Puerto Rico.
Okay.
So still getting that part of like being able to work with the community, I really miss that because I was able to do that like all the time in Puerto Rico.
Yeah,
and
it's such an important piece, isn't it? I know when COVID hit, I started a Facebook group with our local community, and it's actually brought the community closer together, which is brilliant. But there's that disconnect from the community has been so difficult for some people, hasn't it? Especially in terms of that social isolation, which is such an important factor in the context of our optimal brain health.
Yeah, I'm always really resilient, but I feel like with COVID, it was the first time ever that I felt anxious.
Wow.
First time in my life, I was like, oh my God, like, and even though it was a really hard time, at the same time, like it made me more empathic with my patients because I was able to feel what they were feeling. I was, oh my God, like I'm really not able to breathe. And that's such a metaphor, like not being able to breathe in those COVID times. Yes. So yes.
And have you noticed with kids that there's increased social anxiety reconnecting as well?
Yeah, I had kids that just by going back to school, they felt better. So like being so isolated was really, really hard on all of them.
Have you noticed the opposite for some children?
Yes, I was going to tell you that. And I also had kids that they performed so well at home, just one-on-one. So yes, we have like all the.
And does it depend on their brain type? Because for me, I can get super distracted, questionable whether I have ADD or not. I can get super distracted, and I absolutely love to have that quiet time, so I've got the opportunity to focus on something. And I know that being in busy offices is really challenging for me. It's nice to have a quiet space to work. And do you notice that there's particular types of children's brain type
So,
that
for example,
favors socializing?
so having that low prefrontal cortex activity, like of course it contributes, but having that increased activity in the basal ganglia that is related to the anxiety and to always predicting the worst, also related to that. But even with that activity, like still, they were really different. Like sometimes I was like, sometimes I thought that one like kid was gonna be able to work better at the house, and not really. Like they needed that stimulation also.
Yeah.
Mm-hmm.
Yeah. And I certainly noticed, now, actually, since doing this show, one of the reasons I chose to do the show, because I was super nervous on connecting with people. Like social connection has never been my big thing. And talking to people I don't know. And I know we've only just connected just before the show.
Right.
But I noticed since using this medium that I've going back into social settings and big events and stuff, I'm completely different to where I was previously by virtue of the fact that I've been able to kind of unchain that social anxiety by practicing by practicing.
I know, but for example, I am super social. But I told you at the beginning of the of the podcast, I was like, okay, I'm a little bit nervous now because yes, it's just like a first experience. But I remember when, because I was working at another clinic before I came to Amen Clinics, um, that when I had my first patient like back again after having like the lockdown, I was so anxious. I was like this is like learning again. Okay,
Yeah.
so yeah, so that's the same thing, the same feeling that my kids had when they went back to school, like the my patients.
Yeah. And I think it's a real adjustment, isn't it? Because we've got to give ourselves grace, because we've
Mm-hmm.
never ever in the history
Mm-hmm. Mm-hmm. Yeah,
had this happen to us in
exactly.
such an extreme stop state,
Mm-hmm. Mm-hmm.
that we've got to be kind to ourselves in
Yeah, and be forgiven, and yeah. Mm-hmm.
re-engaging, and kind to the mental health state that people
Mm-hmm.
are experiencing,
Yeah, and
because some people have gone, have had so many things change, not
Mhm.
just the social disconnection, but if I like to look at the 4 quadrants of well-being, which is our emotional, our physical, our mental, and our spiritual well-being, is they can all get impacted by COVID,
Mhm.
especially in the context of changes of jobs, like you mentioned for yourself, but some people have lost jobs.
Exactly. Yeah.
Can be
And
hugely.
I always go back to my island because like we have the hurricane, we have earthquakes, we have the pandemic. So like those children that went through all that, like that's super hard. And like it goes back to the emotional trauma.
Yeah, and I've helped people in Australia with natural disasters, which continue to be on the increase.
Mm-hmm.
And I think it's really important you mention that, because um, it's on the rise stateside, isn't it? The number of fires, the number of hurricanes, and it can be huge, even if you live in the sort of hurricane valley, or I've forgotten what it's called, but if you live in that belt where it doesn't make it any easier for you
Mm-hmm.
to
Mm-hmm.
deal with the trauma associated with natural disasters, because you don't have any control
Exactly. Yes.
over what's happening, and that's really difficult for many people, especially children, because they
Mm-hmm.
feed off the emotional environment that they're surrounded by, and if their parents are
Mm-hmm.
emotionally traumatized by it, they're more likely to experience it themselves too.
Yeah, yeah. When we had the hurricane at Puerto Rico, Of course, we didn't have lights and all that
Mm-hmm.
for a long time. And for me, it was so hard that I wasn't even able to give milk to my son. And
Wow.
and when I see him, like he's so resilient. Like again, like if we were strong enough for him, like he was able to went like to go through that. um but up to this point, I was the only movie that we had, it was Hotel Transylvania that we had in, I still remember that we have in the iPad. And still when I see that movie, I get emotional. I'm like, oh my god, I'm just emotional about, but it, because it reminds me of all the
Yeah.
things that we went through. And like if you see those children, like they are so resilient and they were able to overcome that. And but we really need to address still those memories and those issues, but because they keep accumulating, and that's what we see the signs.
Absolutely.
Mm-hmm.
Absolutely. And I think also children um, like to be resilient because they want to keep their parents happy.
Yeah,
And
but
so they can often have this approach of not talking about it
exactly. Yes.
because they don't want to upset their parents who may already be emotionally charged state.
Mm-hmm, mm-hmm.
And I see this especially in clients or guests who've been on the show who have a parent who has mental health struggles,
Mm-hmm.
is that they bottle it up because they don't want to make the situation worse
Exactly.
than it
Mm-hmm.
already is, and then
Hmm.
it appears later on in their life, normally
Exactly.
mid-30s, early 40s, which is
Hmm.
quite possibly why the suicide rate in men is so high
Yes.
at that age.
And that's why
Um,
exploring for that is so important. Yeah.
yeah, so important. I'd love to know in terms of connections, which is the third pillar, but we'll focus on connection to others. Who was your role model in life?
I feel like my great grandfather.
Oh,
Um,
wow.
he was the one that raised me.
Uh-huh.
So like he was that kind of like man that like his morals, his ethics, his engagement with the community, like everybody like in the communities like was always like God bless you or things like that. Like he was like the father in the community that I was like
Wow.
raised. So yes, every time I do something, every time I have an accomplishment, I I know that it's because he gave me that childhood.
Oh, that's
Hmm.
lovely. And
Hmm.
not, I've never heard somebody say their great grandfather, which is so
Yeah,
beautiful that you're able to have such, he was able to have such a profound effect and he was around for you.
yeah. Like that's why like I don't know if that was off camera like that. I told you that I had the best childhood ever,
Yeah.
and it was because of him.
Wow.
Yes.
What made it so special for you? Because it sounds like it goes, because you mentioned that being a child
Mm-hmm.
and bringing that sense of childhood to life is so important. What made it so special for you as a child? What did he do?
It was just the simple things. Like we used to ride bikes together and go to the store and just like he would buy me an icy, or we used to recollect like seeds from flamboyant. I don't know if you've seen that tree that it's really bright and orange.
Okay.
And we used to recollect all the seeds and do bean bags together.
Oh, wow.
So I feel like that's what childhood is about, like learning new things,
Yeah.
like learning to do things with what you have in the environment. Like I love my childhood.
Do you know, I think that's so important. We can get so distracted, can't we, by
All the things
social
that we have.
media,
Mhm,
the
mhm.
internet, YouTube. Kids that just back to nature and back to simplicities kind of
Exactly.
become a bit lost for some children.
Hmm. Hmm.
And it's easy, I'm a parent, it's easy for me to just put YouTube on or Peppa Pig or something to keep my daughter busy whilst we need to do stuff ourselves. But then it does take away that nature of them being creative and just getting on with what you've got.
Yes, I feel like that helped me to be a better mom, just because like I used to like do like the carver thing down the hill. So those things, like, we don't do them anymore. So I've tried to do that with my son.
Yeah, I think it's such an important piece. Is to we like to go away in our camper van and just take our daughter on adventures. And she absolutely loves going on adventures because it gets her away from, just TV and stuff. And we get muddy, get sand everywhere, and it does, just doesn't matter. It's just about allowing them to have fun.
Yes.
Brilliant. So let's go on to the fourth pillar. And I think we're going to run out of time before we get to the end. But for thoughts, what is the stupid, and I know we talk about ants, automatic negative thoughts. What stupid or crazy thought have you often told yourself that isn't true?
More like, I don't know if it's like stupid enough, but it's like, I don't know what I want. Sometimes I get that thought. But I try to turn it around with the things that I know that I don't want.
Yeah.
And that helps me a lot.
Yeah. Do you know, I think that's such a great point, because sometimes we can be soul searching for stuff that we want, but actually we're already there and not taking the time to focus on, actually, I don't want this.
Exactly.
That's not
and
me.
You have to always like when I met Dr. Amen, he told me, like, one of the things that he always says, that does it fit? So does it fit into your life, into your ethics, into like everything? So for me, it's like knowing what I don't want and then go from there.
I've absolutely loved this discussion. What one piece of advice would you give to anybody who is struggling with the childhood trauma that they've experienced, that they feel kind of every time they show up to a situation, or like you say, you get your iPad out and you listen to something from your past, it triggers you and you get transported back into that childlike state? What one piece of advice would you give to anyone who's struggling with childhood trauma?
Just feel comfortable exploring those thoughts, and like we have a lot of things that we can do, like we have EMDR, somatic experiencing, the havening, like all that, like that we are able to like lower that emotional charge from those memories and like be able to work through them better. So like there's always like a space for change, but we just have to be able to like engage in that.
And I think that's so important, is get curious with what's going on, not furious with yourselves, as Dr. Amen likes to say, doesn't he?
Yes.
Is it become an explorer?
Exploring what like really triggers you and working from there. Like we have a starting point, and it's just gonna get better from there.
Yeah, I love that. Thank you for sharing that. Dr. Katyna, how can people get hold of you?
Well, through the Amen clinics.
Okay, and just so the link for the Amen clinics is will be below in the show notes, www.amenclinics.com, and you can find her in the Florida office, which is their new office. It's been an absolute pleasure having you on the show. Thank you so much for coming on the show today.
I really love it. Yes, thank you. Like I was like really worried at the beginning, like, but it wasn't so great. So happy that I did it. Yes.
You're most welcome. Remember, this show is all about brain health, unchaining your pain. You are not stuck with the brain you have. You have power to make it better. And we've had the wonderful Dr. Katyna on the show telling us how. Thank you all.
I really hope you enjoyed that conversation. Thank you so much for listening. Please be sure to like and share this episode and leave a review on my website or on Apple Podcasts. If you're looking for opportunities to optimize your brain health or unchain your pain from a past trauma, make sure you visit my website www.ruthmaryallen.com and use the code podcast10 at checkout to get 10% off all programs. And always remember, you are not stuck with the brain you have. You have the power to make it better. You have the power to unchain your pain and optimize your brain power and performance so that you can win back energy and time doing what you love.
Each episode of Brain Health Unchaining Your Pain with Dr. Ruth Allen is for educational and demonstration purposes only. The information shared in each episode should not be interpreted as medical advice. This episode should not be used to self-diagnose or self-treat any health, medical or physical condition. Do not use this episode to avoid going to your healthcare professional or to replace the advice they give you. Consult with a trusted healthcare professional before doing anything contained in this episode. If you have any questions or concerns, please contact www.ruthmaryallen.com/connect.